Welcome to Yinz podcast. I'm your host Envy. Thank you for joining us today. Today we are launching a special series featuring a renowned clinical psychology professional who has over 16 years of experience in autism spectrum evaluations, cognitive development and developmental delays in children and adolescents aged 2 to 18. Whether you are a parent, educator or someone interested in child psychology, you won't want to miss this episode. Our guest today is Dr. Ginger Martin, a licensed clinical psychologist with over 15 years of experience in autism evaluation, and child psychology, and family support. She is the founder of Mindful Behavioral Health, where she specializes in helping families navigate the complexities of developmental disorders. Dr. Martin, thank you for joining us today. Let us start by addressing a question so many parents ask: is my child just shy or is it something more? What are some of the early signs of autism that parents should be aware of?
Some of the early signs that a parent may look for in terms of autism spectrum disorder um, can be can be tricky to spot, but I always encourage parents to really trust that they know their child. But some of the things that we're looking for, especially in early childhood, would be a language delay. So if we have a child who is not developing language or meeting their developmental milestones with language development, that would be something that we want to kind of keep an eye on. And the second piece would be if language is emerging, but it's not functional. So if children are repeating words or they know their letters and numbers, but they're not using words for function in terms of making their wants and needs known, that would be something that would be an indicator. Another sign would be social delay. So could present itself as lack of eye contact or just lack of interest in social engagement, whether with parent or caregiver or other children. And then lastly, we would want to be looking for any unusual or atypical behavior patterns. So it could be sensory behaviors or repetitive or unusual play.
That's very good information, especially for the parents. Also, there is a lot of misinformation about autism. What is one myth that you would love to debunk right away?
That everybody presents the same way, or we may have sort of a stereotypical example in our mind of what an individual with autism might look like. And oftentimes that can be a very severe presentation. And it's good to remember that autism is truly a spectrum. And so individuals on the spectrum are going to present themselves very, very differently and are going to have various strengths and weaknesses. When we're looking at autism, there's three specific areas of criteria that have to be met. And it's all around a social base, so all around social functioning. So it's important to just have more information and understand how the diagnosis can be mild, it can be nuanced, especially if we're looking at older individuals, adolescents, or even adults.
You have worked with various age groups from 2 to 18. Are there different signs that emerge at different ages? How can parents know when it's time to seek help?
Sure. So when we're looking at younger children, oftentimes the presentation can be a little bit more significant or severe. So oftentimes in early childhood, parents will have a concern if their child has a significant language delay. Maybe they're not, developing language, or if their symptoms are more pronounced. Language delay, developmental delays, social delays in terms of things like eye contact or interaction, responsiveness, and then atypical behaviors. And oftentimes those will be some things that will draw a parent's attention to something that feels off or feels a little bit different in terms of their child's behavior or development. So oftentimes the calls for early childhood, autism evaluations at 18 months or 2 years or 3 years old, we're going to be seeing a little bit more significant symptoms in those three categories. Not always the case. Sometimes there's just a concern with developmental delay and a few behaviors that parents are aware of, and we want to investigate further. But as children get older, if we're looking at school age or adolescence, oftentimes the symptoms look a little bit different. So if we haven't really had many concerns until a child gets to, say, late elementary school, middle school, or even high school, that's an indicator that the symptoms might be a little bit more mild, but also that the symptoms are erring more on the side of a higher functioning autism, or what used to be called Asperger's diagnosis or Asperger's syndrome. And that presentation indicates that the child may have had some typical language development up until, later childhood or adolescence, but that the social delay is becoming more pronounced as they get older. And so it may be things like difficulty forming social relationships, difficulty understanding friendship rules and how to maintain a friendship. Conversation skills can become a little bit difficult as well, how to maintain a conversation, maybe versus just talking about a topic that they're very interested in, sort of more one sided, intense interest. So the presentation at an older state in development is going to just look a little bit different, just based on how the symptoms are presenting themselves.
Glad you mentioned this. Our next question is actually on that ground. What should parents do if their doctor dismisses their concerns, but they still feel something is off with their kids?
So oftentimes, yeah, if you're talking with your pediatrician, which is often, the first place that you'll go to talk about, you go for your whether it's yearly or monthly checkups with your child, and they may often do some developmental testing. It's great to bring those concerns to the pediatrician. They often have a relationship with your child. They know them pretty well. And so most pediatricians are very interested in early intervention and being proactive as well. And so they may do some early screening, and get your child connected with, say, early intervention services or outpatient speech or physical therapy or occupational therapy. But if you don't feel like the pediatrician is responding to your concerns, you can always ask for a referral to a specialist or seek that out. Whether it's just sort of going to some of the providers in the area, or some of the agencies in the area that provide consultation and this kind of diagnostic evaluation.
Okay, so parents should try to get individual evaluations. That's a great suggestion. Finally, after all the evaluations you have conducted, what is the most common reaction you get from parents after they receive a diagnosis?
So there's usually a lot of questions. Probably the biggest question is sort of what do we do next, and sort of what can we do to help. And so that is definitely a huge component of the feedback session, is spending a good amount of time talking about the specific plan for that child and what that looks like, and explaining exactly what parents can do to take the next steps that will help get their child the services and the support that they need. Um, Overwhelmingly, most parents are happy to have an answer. Oftentimes, the diagnosis is confirming maybe what they already knew or had questions about, and so to have the clarity often just provides a sense of relief and then a sense of control, because now we can move forward and we have a plan and we can understand the child a little bit better. And so I think it's all about kind of, supporting parents until they get connected with the next steps. It's not just, okay, the evaluation is over and, good luck. It's about, making sure that they're supported in how to get to the next steps. And that's always an option, is to kind of keep that door open if there are questions that come up after the evaluation, or any consultation that needs to happen following that.
Dr. Martin, you have more than 15 years experience. You might have noticed a lot of changes in awareness of parents and in the society because of the internet and social media. What are the key differences you have noticed?
That's very interesting. Um, the key differences, I would say, definitely there's more information. There's more, I think, just in the sort of in culture, in the society about autism. I think there's so much more awareness, and I think people have had more and more encounters with an individual with the diagnosis, and so that helps. Again, like I said, to see that spectrum of how it presents versus that stereotyped idea of what an individual with autism may present like. So I think there's definitely more information, and I think that also helps parents to be a little bit more savvy on picking up on the subtleties. So I will see, sometimes, like I said, early childhood evaluations can be more significant presentation of symptoms, but sometimes it's still very subtle, and sometimes it is, parents who are really keeping an eye on things, or really noticing a difference between this child and their older sibling and how they developed, or just sort of noticing, boy, this feels different. And so I do think that, just awareness, and with awareness comes, more possibility for early treatment and early diagnosis.
That wraps up episode 1 of our series with Dr. Ginger Martin. We hope this episode helped you better understand the early signs of autism and ADHD. In the next episode, we'll explore the key differences between autism and ADHD and discuss What happens when a child is diagnosed with both? So be sure to join us next time for episode 2, where we will dive deeper into these two conditions.